Hello, I'm Dr. Alka Godbole, a senior gynecologist from Thane, Currae Hospital. Today, I'll be giving you a brief about how to take care of any girl child or a woman at different stages in the life of woman. So, if we start from a newborn girl child, so many a times patients approach us that within 2-3 days after delivery of a girl child, there is slight spotting or bleeding from the genitals of a newborn girl child. So don't panic, it's very common because that is a hormonal status that depends on hormonal status of a mother. So within 2-3 days it goes on its own. So don't panic, only keep the organs clean. Next is cleanliness of genital organs of a girl child. It's a very important aspect. Whenever you are taking care of a newborn girl, you have to take these precautions about her genitalia, because this will be affecting in her later life. So then this vaccination and all, everybody knows, or the pediatrician is there to take care of this vaccination part. So let us see, when this newborn girl grows into an adolescent girl, when she becomes around 5 years old, between 5 to 12 or 5 to 11 is the peak period of her development of all organs. Her height rises, her vocabulary increases, everything, and main thing is genitalia also are developing. So some patients or some girls around 9 or 10 years, they get early menarche, that means starting of menses. This menstrual cycle generally starts at 13 to 14 years of life. But in some patients, in some girls, it is starting around 9 years or 10 years. That means if she is in 4th standard, 5th standard, then that becomes a tedious job for a mother to take care. So they approach me. So I always tell them that you advise them, you teach them how to take care of your private parts, how to keep your diet, means that should be looked after by mother only. And the third one is exercise. Tell her to play on the ground, not on TV or computer or mobile. So this is a must, because nowadays these adolescent girls are increasing weight day by day. Previously, 10-15 years back, there were very lean and thin girls approaching us. But nowadays, the increase in weight is a big issue for parents also. So be careful. When this girl grows into a young girl, that means after 12 up to 18, she becomes a young adult slowly. Many a times, first their breasts start developing, breast buds are developing, so they become conscious. Many a times, immediately they start getting menses, that is bleeding. And about this bleeding, I want to clear one part, that whenever they have started menses, in early stages or in early years, they are always irregular. That means once in 6 months or twice or thrice in 1 year. So don't be shy and don't approach immediately to doctor, because nowadays for every girl, mother is rushing to us. Madam, she has got first period, what to do? Mother should know what to do, how to tell her cleanliness, personal cleanliness, changing pads, sanitary napkins regularly. Then main thing comes is their eating habits should be good habits. That should be looked after by parents, because nowadays there are so many attractions outside, so many imported foods are available, or pizza, burgers, lots of eatables are there, and I think this is the culprit of their increasing weight nowadays. Every girl, every fifth girl is having irregular menstrual periods. To start with, it's okay, we don't do anything, but afterwards we have to see that their periods should be regular, when it should be regular, how it will be, because of proper diet, proper exercise. So this is called PCOD. Nowadays every patient knows that, oh madam, I got PCOD, or she tells, no, previously I used to have PCOD, PCO problem and all this, because everybody knows from Google, they learn that PCO is a problem, what is there, and from sonography report also they can see. So if we see in married woman, when this girl gets married after 20 or around 25, that becomes a problem. If this PCO persists, it is not getting treated, then it becomes a problem about weight. First thing is weight, then second thing is diet. They should be having very, very particular diet. Then third is exercise. Every girl should get exercise every day, at least half an hour, in form of anything, walking, simple walking, running, then cycling, gym, yoga, anything, but she has to do exercise, because this will cure her all disorders. The main thing is menstrual disorders, what I have told, that these disorders are scanty menses, heavy menses, irregular menses. Then comes, because of this, there is infertility, that is inability to conceive a child. Many a times these girls take so many oral contraceptives in early stages of marriage, means for first 3 years or 4 hours after 4 years after marriage, and that time they should be careful. They should take advice of a consultant doctor that whether they should continuously take or intermittently, and which type of contraceptive, because it depends on that also. If she is using hormonal contraceptive for so many years, then there are very less chances of having pregnancy easily. Once she gets advice that if it is, and next thing is I want to talk about, because that age of marriage is increased. So because of this increased age, nowadays they have got more infertility problem, because once they are married around 27, if they carry on family planning procedures like using condoms or anything, using hormonal tablets or any other things, then it becomes a late pregnancy. After 30, fertility starts decreasing. The ova type is not so good as it was before. So that also should be kept in mind. This is about married women. There are so many other problems also in married, after marriage. There are urinary problems and so on. But those are taken care of lightly. But this menses is very, very important. Then when that lady crosses that age, she comes to middle age, around 35, 40. Between 40 to 50 is the main thing when she has completed her childbearing. But that is the time she can increase weight. So exercise is must at any age, and control on diet, that is a must. main thing is in these middle age, there are so many irregular types of bleedings. So many patients approach us, oh whether, and all are worried that whether, oh madam, shall I get early menopause? I always ask them, how you are asking about menopause? Menopause is not that easy. Around 45, 50 years, that is the age of menopause. Around 40, if they get irregular periods, there are so many causes. There are fibroids, polyps, then what not. They can have some reproductive tract infections, or because of repeated sections, cesarean sections, they must be having any abnormal things or complaints. And if there is bleeding, then that can be taken care of by consultants, by doing sonography and proper investigations about blood and other things. The next thing is perimenopausal woman, means she is in between having menopause and normal menses, means after 45 or after 50, that is the age for perimenopause. That time she has to take care of her periods. If her periods are scanty, it's okay. But if they are irregular and if there is a continuous bleeding, then there can be a pathology in her reproductive tract. Then for that, she has to undergo for major or minor type of operations. Then there are sometimes she gets prolapse, that is something coming. Always the patients complain that no, I am having looseness of vagina, something. I always think that something is coming out because of prolonged vaginal delivery, because of some other abnormalities. She can have prolapse of uterus, even bladder, that we call cystocele, that only the bladder thing comes down, that can be get operated from vaginally and within few days. That is very minor operation, but it should be taken care of. And other urinary complaints. So many times she is having stress incontinence. That is a major cause when we are concerned. Many a times because of urination, frequent urination, whenever she laughs, she talks, she lifts any weight, heavy weight, she urinates on her own, means unknowingly. That is a stress incontinence. There are so many types, but generally patients complain that whenever I sneeze, there is a urine leak. So it should be taken care of, or she should come and see gynecologist. Then there are premenopausal or perimenopausal symptoms that can occur into after menopause, before menopause. Just before menopause starts, that means 2 years before also these complaints start. They always complain that there is sleeplessness. Madam, नींद ही नहीं आती, 2-3 रात मैं जागी हूँ. And if we ask about her sleep pattern, she never sleeps in the afternoon also. She is always awake. So there is headache, there is giddiness, she gets hot flushes, means even in sitting or sleeping in AC, she gets too much perspiration. So these are all symptoms, and then actually these perimenopausal or menopausal symptoms start from top to bottom. From top, if we see about hair becomes sparse. There are some wrinkles coming on face. Skin becomes loose. Breast sag. Then abdomen, around abdomen means middle part, chubbiness starts approaching there. Means fat is depositing on there. Then sometimes there is joint pains. She will complain backache and whatnot. There are so many symptoms. She will complain tingling numbness in both extremities. So we can know from, and in that case we ask about her menstrual history, whether she is having menopause or she is approaching, how is her menstrual pattern, like that. So this is about perimenopausal woman. Now if we come to the menopausal woman, menopause is all established after or around 50. Sometimes up to 54, 55 menses can go normally, but this is very rare. Around 50 years of age, generally patients are amenorrheic, that is scanty menses or absent menses, or so many times this menopause is artificial menopause because they have got their uterus removed for some or other reason. So in those patients we have to take care, because in those who are having artificial menopause, those are complaining more symptoms like hot flushes, because immediately slowdown of hormones. Their hormonal control totally goes off within a day. So that happens whenever there is operation, means uterus is removed. So for that purpose, so many times doctors try to preserve ovaries. So in such way, and if she goes to a parlor, it's good, well and good, but everybody cannot afford to go even beauty parlor also. She has to take care of herself. Cleanliness again, and every 2 years or every year after menopause, she should get her sonography done and all the investigations, proper normal investigations about blood pressure. For blood pressure means cholesterol, lipid profile. Then for diabetes, she should be investigated for glucose fasting and postprandial, means after lunch. Then normal blood count. All normal investigations and sonography should be done every 2 years, and in between, if she has any complaints, she should be investigated every year. So in this way, if we take our care as a woman, means any woman will be happy, and if the woman is happy, the home and people around her are always happy. So that's all.